For the first time since 1920, almost 100 years, there will be an increase in fees for public health care services in the Virgin Islands. According to BVI Health Services Authority, the increase is necessary to meet the growing costs to provide health care services, supplies, and medication. The government of the Virgin Islands has been assisting with the cost of health care by providing $23.1 million subvention annually to assist with the BVI HSA operations. However, CEO Darlene Carty-Baptiste says the cost of providing health care has gone up, noting that the actual cost is about $34 million annually. Carty-Baptiste's remarks came during a media brunch discussion about the challenges, opportunities, and strengths of the BVI HSA. She warns that the BVI HSA is in arrears for payments to vendors of pharmaceutical products and other healthcare supplies.
And everything else around us has changed. The cost of providing services has changed. We're not negating the fact of the financial hardship or challenges that persons arise, but again, with folks not being, with the BVI not being compensated, we're into the place now of where there's significant arrears for our suppliers and vendors. Our indebtedness has been a burden on the authority for quite some time, and it's actually jeopardizing the type of services we may be able to provide in the future. So again, we're looking at quality, but again, there's always a cost. We cannot tell, a particular vendor or pharmaceutical company that, oh, it's coming. Our lines of credit have been in question, and it's to the point of where some of our vendors are now saying monies before supplies.
The BVI Health Services Authority proposal for the fees increases is now before Cabinet. According to Carty-Baptiste, the proposed fee structure is based on current market price, but it is below threshold. The $34 million operation cost for the Health Services Authority forces it to fill an $11 million gap annually, with additional dependence on government for financial assistance to continue its operation. This is coupled with an over $20 million debt owed to the BVI HSA by residents in outstanding payments. Added to this, the cost of newborn care was never billed to mothers. Carty-Baptiste further noted the importance of the National Health Insurance Plan to strengthen the services offered by the Health Services Authority.
We cannot sustain the level of operations based on our current indebtedness. It is hampering us moving forward. So even if we just do marginal increases over the next 2, 3, or even 5 years, we've got to address it in real time. Specifically to the National Health Insurance, again, part of the presentation was talking about us being a preferred provider. We are going to be, for all almost like a safety, we are the safety net hospital. We are the catchment. When there is a true emergency, 100% of those persons, you cannot get off the island unless you come through the system. So it behooves us to have the system strengthened and robust and prepared to address you in your greatest need.
Senior patients and school-aged children are not required to pay for medical services offered by the Health Services Authority's outlets. However, prescriptions issued by private health services do require payment. The planned increase in public health care fees comes as the BVI Health Services Authority seeks to improve efficient management functions. Other initiatives include continuous quality improvement, streamlining accounting and other operational processes by automating services to improve efficiency.